Pig heart successfully transplanted into Baltimore man. Baltimore, Maryland, surgeons have successfully transplanted a genetically modified pig's heart into a human patient for the first time. A 57-year-old man with terminal heart disease received the organ in Baltimore, Maryland, on Friday, the University of Maryland School of Medicine said in a statement Monday. This organ transplant demonstrated for the first time that a genetically modified animal heart can function like a human heart without immediate rejection by the body, the statement read.
He's awake. He is recovering and speaking to his caregivers, and we hope that the recovery that he is having now will continue. We've never done this in a human, and I like to think that we have given him a better option than what continuing his therapy would have been. But whether it's a day, week, month, year, I don't know. Probably the biggest risk is now. We seem to be past what we consider the hyperacute rejection phase that we would normally have seen in an animal organ that wasn't specially treated. So we feel good about that one. So we're preparing for the next attack on his organ. We know that the pig heart will be attacked by different soldiers in our body. Different immune players can take it out, and we have designed a treatment plan in addition to the humanized, genetically edited heart to try to account for that.
The hospital said David Bennett, a Maryland resident, was doing well 3 days after surgery and will be monitored for the next few weeks to determine whether the transplant has provided life-saving benefits. He was considered ineligible for a conventional heart transplant at the Maryland facility, as well as at several other leading transplant centers that reviewed his medical records. It was either die or do this transplant. I want to live. I know it's a shot in the dark, but it's my last choice, the patient was quoted as saying a day before the surgery was performed. He had been hospitalized and bedridden for the past few months and said he was looking forward to recovering and to getting out of bed. A breakthrough with potentially huge consequences. Surgeon Bartley P. Griffith, pictured with his patient, David Bennett. The U.S. Food and Drug Administration granted emergency authorization for the surgery on December 31. About 110,000 Americans are currently waiting for an organ transplant, and more than 6,000 patients die annually before getting one, according to the government's organdonor.gov site. Scientists have been trying for some time to grow pig organs in that can be transplanted into humans. Here's kidneys and lungs have been the focus. Many questions remain open after this astonishing medical breakthrough, mainly related to the longevity of the organ. The full results will also have to be published in a scientific journal before research begins into whether any positive results can be replicated.